Hello, my name is Moses Okoson. Today I'll be talking about modem of health promotion. Firstly, we'll be talking about summary of current modem of health promotions. Modem of health promotions are used for providing of frameworks that makes it possible for understanding and influencing health behavior. This include the trans-theoretical model. This is about of change where behavior changes are described as a process through stages. The stages are contemplations, preparations, actions, maintenance, and relapse. While the third one is the ecological model. This is the model where many levels of influence on health are recognized. Some examples are individual, interpersonal, community, societal influence. And the fourth one is the health belief model, which focuses on individual perceptions and modifying factors that influence health-related behaviors. The fourth one is the theory of planned behavior. This suggests that intentions shaped by attitude, subjective norms, and precise behavior. While the fifth one is social connective theory. This theory lays emphasis on the interactions that exist between personal factors, behaviors, and the environment, having self-efficiencies as a key component. So on this slide, I'll be talking about a comparison of at least two modems used in health promotions. The two modems used in health promotions are health belief model and the trans-theoretical model. So I'll list the comparisons of each one of them. In health belief model, which are strengths, focus, applications, key components, and limitations. In trans-theoretical model, the comparisons are strengths, focus, applications, key components, and limitations. In this fifth slide, I'll be talking about an evaluation of effectiveness of the two models in promoting good health. So one of the effectiveness are health belief model. This effectiveness, it is used for predicting preventive behaviors, but less effective for substance lifestyle change. The limitation, it overlooks social determinants and behavior formations. While the second effectiveness are trans-theoretical model. The effectiveness, it is efficient for prolonged behavior change as seen in smoking cessations and exercise by addressing the readiness to change. The limitation are it is criticized for making the stage look so simple and it lacks inconsistent intervention sources. On the next slide, I'll be talking about health promotion initiative. The health promotion initiative of choice is Health Living, Health Communities. It aims at improving public health, promoting healthier lifestyle choice, preventing chronic disease, and reduce health differences. To foster long-term well-being, the initiative focuses on education, communities, engagement, and policy support. Aim and objective of this initiative are: 1. To encourage healthy eating habits by encouraging increases in consumptions of fruit, vegetable, whole grain, reductions in the taking of processed food, sugar, and excess salt. The second aim is promoting physical activities by making public space for exercise safe and accessible, e.g., park, walking trail, and bike lanes. Through organizing community fitness programs like yoga classes, walking club, and support league. The third aim is preventing chronic disease. Awareness creations about risk factors for chronic disease, providing of free or low cost health screening, support of smoking cessations and alcohol moderation program. The fourth aim is improve mental well-being by reducing of stigma around mental health issues, promotions of stress management techniques, strengthening of community support work. And the fifth one is enhance health literacy through educations of the public on recognizing symptoms of common illness, improvement of understanding of preventive health care, use of digital platform to disseminate reliable health information. The effectiveness evaluations. We'll be talking about the effectiveness of evaluations to assess the source of the initiative. To assess the source of this initiative, we use both quantitative and qualitative measures. Number one is short-term success, which is 6 to 12 months. And number two is medium-term impact, which is 1 to 3 years. This assignment is the reductions in risk factors to ascertain decline in smoking rate and sugar drinking consumptions. While the third one is long-term outcome, which is about 5 years plus. In this next slide, I'll be talking about trust agencies in WHO. The World Health Organization is a leading global agency recognized for the directing of international health initiatives, setting norms and coordinating response to health emergencies. It works sufficiently, impacts significantly on public health worldwide. Key contributions to public health. Number one is disease prevention and control, eradications of smallpox. The WHO contribute to the eradications of smallpox in 1980. Polio elimination efforts reduced global polio cases by 99% through vaccinations campaigns. Second key contribution to public health is emergency response and pandemic management, which is COVID-19 response. The WHO coordinates global research, vaccine distributions, and public health guidelines during the period of the dreaded COVID-19. Ebola outbreak control also deploy rapid response. Teams and supported vaccines development during the Ebola outbreaks. The third key contributions to public health is health policies and advocacy. framework conventions on tobacco control. This contributed to reducing global smoking rates through taxations and advertising bans, universal health coverage promotions. It advocates for equitable healthcare access globally. The fourth key contributions to public health by the WHO is health education and awareness. Global vaccination campaign. Through awareness creations, there has been increased immunizations rate for measles, HPV, and other preventable disease. Promoted policies to reduce sugar intakes and improve food labeling through anti-obesity and nutrition initiatives. Thank you.